Concerns are growing this morning after a deadly hantavirus outbreak linked to a cruise ship. This has been all over the news. No doubt you've heard about it. It's raising questions about just how prepared we are for the next global health threat. Joining us live this morning is Virginia Tech disease ecologist Dr. Luis Escobar to break down what makes this strain different, what we're dealing with right now, what experts say is a wake-up call, though, for public health systems worldwide. Dr. Escobar, thank you so much for joining us this morning.
Thank you for having me.
Let's start with this. If you have never heard of the hantavirus before, what's unique about the biology of this virus and specifically this Andes strain that has been spreading person to person, believed to be spreading person to person?
Well, hantaviruses are different in the sense that they circulate in rodents mainly, and that has a global distribution. So rodents worldwide are going to have different strains of hantavirus. Depending on the rodent species is the different strain of hantavirus that we find. And for Andes hantavirus, it relates to the Andes mountains of South America, is where the virus is endemic. In Chile and Argentina, for example, there are annual cases of hantavirus that generally occur from the transmission of the virus departing from the rodent to the human.
Right. So that's why I think most of us are familiar with it from rodents to humans here. And we heard of this on this ship. And for the 17 Americans who are returning to the U.S. today, they're being taken to a quarantine unit in Nebraska, some being transferred for biocontainment to a unit. But that wasn't the first protocol that we heard about, including the passenger from Virginia. So why does guidance appear to be changing here?
I think that some of the efforts are trying to avoid panic, and they're trying to learn from the virus. This is one of the first international outbreaks of hantavirus that we know. So we're still learning. And the general assumption is that you need close contact, for example, but we are now learning that the virus is as the early cases that we found in South America show, for example, people taking care of patients being infected. So I guess that's why they are trying to be a bit cautious.
Okay, this is the million-dollar question here on everybody's mind. Does the Andes hantavirus have the potential to become a pandemic in North America?
To me, it has the potential, and it's showing it from this example. So the fact that there are cases that became silent and people returned to their houses. So something good that is happening is that we are learning from COVID-19 to be more coordinated, to have international collaboration, to have fast isolation. For example, that's why they are handling the way they are handling the passengers and sequencing the virus. So I think we are more prepared in the sense that we learned some lessons, but and the virus is showing that it has pandemic potential, in my opinion.
Okay, we will continue to watch. Pretty scary headline right there, though. Dr. Escobar, we do appreciate your time. Virginia Tech disease ecologist Dr. Luis Escobar, thank you.
Thank you.